Hospitals are using sound waves to heal broken bones. And it all started with sand on a metal plate in 1787. Part 1. What is cymatics? The word cymatics comes from the Greek chyma, meaning wave. It describes the study of visible sound and vibration. Not sound as we hear it, sound as we can see it. The story begins in the 18th century with a German physicist named Ernst Chladni, often called the father of acoustics. Chladni took a flat metal plate, scattered fine sand across its surface, and drew a bow along its edge, creating sound vibrations through the metal. The plate vibrated, and the sand moved. This was the first time in recorded history that sound had been made visible, not randomly, but into precise, symmetrical, geometric patterns. Now, what you're seeing here is a digital recreation of exactly what Chladni witnessed. Particles responding to sound frequency changes in real time. Each frequency, a different pattern. Those patterns are now known as Chladni figures. 2 centuries later, Swiss physician Hans Jenny took that discovery further. Working with sand, water, oils, metal filings, fine powders, and viscous pastes, Hans Jenny spent years documenting how sound organizes physical matter across different states. The results were extraordinary. Every frequency produced a unique geometric signature. Hans Jenny called this cymatics. But it was what happened next that changed everything. Because one researcher looked at these patterns and asked a different question entirely. Not, what does sound look like? But, what can sound do? Part 2. Dr. Peter Guy Manners and the sound wave applicator. That researcher was a British osteopath named Dr. Peter Guy Manners. And while Hans Jenny was visualizing sound in his Swiss laboratory, Manners was asking whether sound could be used to heal the human body. He began his research in the 1940s. Not alone, but in collaboration with a group of scientists and medical doctors. Their focus was the vibrational codes of the human body itself. Manners operated from a foundational premise.
Precisely so. It is literally the transplanting or the transmutation of accepted frequencies of sound into the tissue and structure of the human being. All the areas of the body, all the organs of the body produce a harmonic, a sound. This sound is very small and very minute. This again is not a new concept, not a new theory, but it is only in comparatively recent years that technology has caught up with the concepts and the ideas of this, and we've been able to reproduce these frequencies and sounds. And now we can reproduce them, create them artificially, and transfer them back into the tissue and the structure. A lot of our doctors are referring it to transplant, because technically, I suppose this is what we are doing. We are transplanting the corrected frequencies back into the structure to replace any abnormalities that exist there. Also, of course, one of the strongest points which we advocate is that we can use this in place of drugs and medicine. And if we can replace medicine with treatment, we find this is much better. It takes a little more time, and you have to have a little more attention from your individual practitioner or your doctor. But then that is one of the things which we are trying to push forward at the present moment, that the medical profession treats every individual as a holistic being rather than a condition.
His hypothesis is therefore that sound, applied correctly, could restore. Over decades of painstaking research, Manners identified something crucial. Single frequencies were not enough. What the body responded to was a precise combination of 5 frequencies working together. He called these combinations commutations, and by the end of his career, he had developed approximately 750 of them, each one mapped to a specific physiological function: tissues, organs, glands, bones. The conditions he worked with were wide-ranging: arthritis, both osteoarthritis and rheumatoid, where inflammation disrupts the body's natural resonance, including rheumatism; lumbago and lower back pain, including slipped disc; bone fractures; and perhaps most remarkably, certain forms of paralysis, where conventional medicine offered little beyond management. To deliver these commutations directly into the body, Manners designed a device, the Mark I, a handheld sound wave applicator, a transducer, that drove coherent acoustic waves directly into tissue. Not sound played into the air, but conducted into the body itself. Meanwhile, American researcher Mandara Cromwell had spent years studying directly under Manners, and before he retired, he handed her his life's work. "I have taken this work as far as I can. Now it is your turn." In over 50 years of research and clinical application, what Manners started and Cromwell continued represents one of the most sustained investigations into sound as a healing modality ever undertaken. A direct line from Hans Jenny's sand patterns to a clinical treatment device. What started as a question about frequency became a lifetime of work, one that mainstream medicine was quietly about to confirm. Part 3. What mainstream medicine found. Manners was working outside the mainstream with progressive ideas and bold research, but mainstream medicine was quietly arriving at a similar conclusion, through a completely different door. The question orthodox science asked was simpler. Can sound waves accelerate healing in the human body, not through resonance or commutations, just mechanically, physically, measurably? The answer, it turned out, was yes. The technology is called low-intensity pulsed ultrasound, LIPUS for short, a non-invasive, painless therapy that delivers acoustic microvibrations directly to targeted tissues, stimulating cellular regeneration and accelerating bone fracture healing without causing significant tissue heating. Commonly used in sports medicine and orthopedics, working without a single incision. The first human application was reported in 1983 by Brazilian researchers Xavier and Duarte, who successfully treated fracture non-unions using pulsed ultrasound, achieving a 70% healing rate. Sound, delivered to the body on a timer. For context, a fresh fracture is a recent break, still in the early stages of natural healing, while non-union, sometimes called a delayed union, is what happens when that process stalls. The bone simply stops progressing. No bridging, no callus formation. Clinically, non-union is defined as a fracture, showing no signs of healing after 9 months. The conventional answer is revision surgery, going back in with all the risk and recovery that entails. LIPUS set out to offer an alternative. In 1994, the United States Food and Drug Administration approved a LIPUS device for clinical use, approval that requires demonstrated safety and clinical efficacy. That device is called EXOGEN, made by Bioventus. It remains in clinical use today, and one of several FDA-approved LIPUS devices in active clinical use worldwide. In the United Kingdom, NICE, the National Institute for Health and Care Excellence, the independent body that evaluates medical evidence and advises which treatments the NHS should adopt and fund, endorsed EXOGEN in 2010 specifically for long bone fractures with non-union. That guidance was reviewed and updated as recently as 2019. Their assessment found that adopting EXOGEN saved an estimated £2,400 per patient by avoiding surgery altogether. The clinical evidence behind that endorsement is substantial Level 1 studies, the highest tier of clinical evidence, demonstrated that this specific ultrasound signal accelerates healing time in fresh fractures of the tibia, radius, and scaphoid by up to 40%. A fracture that might otherwise take 15 weeks to heal, potentially healing in 9. A 2024 review in the Journal of Ultrasound in Medicine confirmed LIPUS accelerates healing of fresh fractures, non-unions, and delayed unions across numerous studies, regardless of device used. One published case series brings this into sharp focus. Over 9 years, 2013 to 2021, 18 patients with confirmed fracture non-union were treated with EXOGEN at a Scottish district hospital. Bones that had already failed to heal through conventional management. The overall healing rate was 94%. No significant adverse effects were detected across the entire 9-year period. The authors concluded LIPUS represents a viable, cost-effective alternative to revision surgery. It is worth noting that LIPUS is not a universal solution. Evidence is strongest for non-union and delayed healing, while for surgically managed fractures, results have been somewhat less consistent. But the principle is now established in orthodox medicine. Sound waves, applied correctly to living tissue, do produce measurable biological change. The language is different from manners. The mechanisms are different, but the truth is the same. Part 4. Sound as a diagnostic tool. We have seen what sound does to sand. We have seen what it does to bone. Now, what does it do to a single living cell? This is where English acoustic physicist John Stuart Reid comes in. Reid invented the CymaScope, a scientific instrument that makes sound visible by imprinting sound vibrations onto the surface of medical-grade water, a visual fingerprint of sound. But another discovery made his work possible. In 2002, Professor James Gimzewski of UCLA, working with colleague Dr. Andrew Pelling, used an atomic force microscope to listen to living cells for the first time. What they found was unexpected. Cells produce sound within the audible range. Gimzewski named this new field Sonocytology, from sono, meaning sound, and cytology, the study of cells. Reid's lab then asked the next question. If cells produce sound, what does that sound look like? Working with Professor Seung-Chul Ji and researcher Byum-Jun Park of Rutgers University, Reid used the CymaScope to image the acoustic emissions of living cells from human brain tissue, both healthy and cancerous. Published in the Water Journal in 2019, what they found was striking. A healthy cell produces a symmetrical, coherent, cymatic pattern in water, ordered, geometrically consistent, almost mandala-like. A cancerous cell produces something entirely different, distorted, asymmetrical, chaotic. The harmony becomes a cacophony. The clinical implication is remarkable. A laser probe detecting cell sounds during brain surgery, rendered visible via CymaScope in real time, could help surgeons identify the precise margins of cancerous tissue during tumor removal. Sound as a surgical guide. Still in early development, but a published, peer-reviewed step toward that future. Now, hold this thought. The human body is at least 70% water. Japanese researcher Masaru Emoto spent years photographing frozen water crystals exposed to different sounds and music, finding that harmonious music produced elaborate symmetrical crystals, while discordant sounds produced chaotic, irregular formations. Water responds to sound, visibly, measurably, and Reid's CymaScope works on exactly the same principle, imprinting sound vibrations onto water to reveal what frequency actually looks like. That is not a metaphor. That is your body, 70% water, responding to sound. Right now. Part 5. Seeing sound for yourself. If you want to experience Cymatics directly, CymaVis is worth exploring. A free browser-based Cymatic simulator. No download, no account required. Go to cymavis.com. Use your voice, an instrument, or any sound source, and watch thousands of virtual particles migrate into geometric patterns in real time, exactly as sand does on a real vibrating plate. Link in the description for more details. In conclusion, we began with sand on a metal plate, a bow drawn across an edge, leading to sound becoming visible for the first time. From that experiment in 1787, every discovery in this video follows a single, unbroken line. Hans Jenny documenting sound organizing matter across various materials. Manners spending decades mapping the vibrational codes of the human body, treating arthritis, rheumatism, lumbago, slipped disc, and forms of paralysis with coherent sound waves applied directly to tissue. Orthodox medicine confirming that sound accelerates bone healing, prescribed by orthopedic consultants, endorsed by regulatory bodies on at least 2 continents. Reid's laboratory revealing that healthy and cancerous cells leave visually distinct sound signatures in water. And the discovery that our own cells are producing sound right now, whether we can hear them or not. The human body is at least 70% water. Water responds to sound. Sound organizes matter. These are not separate ideas. They are the same idea, observed across centuries, across disciplines, across cultures. Practitioners have understood this intuitively for a long time. Those working with tuning forks, gongs, and singing bowls, feeling vibration move through the body, resonating through tissue, bone, and water with every strike. These are not merely beautiful experiences. They are cymatics, happening in real time, in the hands of the practitioner, and in the body of the person receiving the sound. The science is still evolving. The full picture is not yet complete, but the direction it is pointing has been consistent for over 2 centuries. Sound is not just something we hear. It is something we are made of, and something that, applied with intention and understanding, may yet prove to be one of the most powerful tools for healing we have ever had access to. Coming up in our next series, we explore the body in motion, pain, fascia, movement, and recovery. The science of why we hurt and what can be done about it. If you enjoyed this video, please like, share, and subscribe to support the channel and be notified of future content. Ruya Wellbeing, wellness insights for everyday living.